Sounding at fire departments around Western Washington. But this emergency is personal for the men and women we rely on to rescue us in times of need.
During the pandemic, first responders were under a high level of stress, and that unfortunately is becoming worse with rising levels of violence, drug abuse, and homelessness. Fox 13's Nikki Torres has details of a new behavioral health program getting set up by local fire leaders hoping to help crews.
Well, in 2021, Renton Regional Fire responded to more than 23,000 calls for emergency. And of that, this station here, Station 13, they responded to about a quarter of those. These ranged calls from medical emergencies to home fires. But the bottom line here is that they need their firefighters to be at their best, and they just cannot do that if something is weighing on them mentally. The concern for firefighters' mental health has never been greater than right now.
We see burnout, we see high retirements.
Firefighters, EMTs, the people who come to the rescue in times of need are now seeking help for themselves.
Suicide, this is the highest it's ever been.
Deputy Chief Chuck DeSmith works with Renton Regional Fire Authority. It is one of 12 fire agencies in Western Washington working to find a solution to the mental health crises across first responders.
Something to help at least address the fact that we're having all these needs. And so we needed it yesterday.
Fire stations provide crews with everything they can to stay safe. Helmets, boots to protect themselves from flames, most recently bulletproof vests in case of gun violence at a response. Yet in 2023, there's no set service to help crews cope with the aftermath.
Normally, we know that when we enter this job, we're going to see those things, and we're able to kind of file them away in our brains. But if things are difficult at home, this could be the last straw.
Deputy Chief DeSmith has been a firefighter for more than 30 years.
When I started in the 80s, the way that the community would use 911 was very different than today. It was very much associated with emergencies.
He says calls now are for chronic health needs.
Sometimes our firefighters have to see these patients over and over every day. And when they do that, it affects them because they got into this job to help.
The big three, people who are experiencing homelessness, people with mental health problems and opiate addiction.
When you end up giving Narcan to the same person twice in one day, it does impact us because we want to help. And these are individuals that we know they have chronic needs.
Deputy Chief DeSmith adds more of the 911 calls are for violence.
These are not accidental shootings. These are targeted shootings and stabbings that our folks are coming into work and they're seeing this trauma.
How that trauma affects firefighters when they go home to live their life with their partner, their family, that is where their concern is. The behavioral health program in the works is a start.
We can't control who calls 911 for what. I cannot make this job any more safe or calls that they're going to go on. What I can do is understand how we respond and how to support our firefighters, not only here at work, but at home.
UW ran a survey for all EMS agencies in King County. That's more than 3,000 workers. About 40% said that they were experiencing burnout, and women were reporting a lot higher than men. We're live in Renton this evening. I'm Nikki Torres, Fox 13 News.